Hello, beautiful humans, beautiful mamas, mamas to be, women, men supporting women, chiropractors, coaches, all the things. This is episode number 276. And today we are talking about CrossFit, modifying in CrossFit. So, this is a great question. And I often forget that this is a question that comes about, I would say, at least every other week since BirthFit's inception of 2013. And I often forget that this question is not answered, especially for those that are newly embarking on their pregnancy journey. And if if this chapter is completely new to you, this is a solid question. And I got this question this week. Hi, I'm 12 weeks. Before pregnancy, I was doing CrossFit sessions 3 times a week plus running. Um, During the first trimester, I dropped to 2 CrossFit sessions at a lower intensity. I bought the BirthFit Basics prenatal program and did some walking. Now I'm feeling more energetic and thinking about gradually increasing the intensity again. As the belly starts to grow, are there any CrossFit movements you'd absolutely avoid? I've already stopped sit-ups and toes to bar and similar movements, and sometimes I feel a bit of tightness or stretching throughout my belly doing certain movements, but it settles quickly. How do you decide when a movement should be stopped and modified? And what are your red flags? Help help. So this is a really solid question, and I think she framed it so beautifully. Um, I don't think I could have asked a better question. So let me pull up some notes I have and how I answered this woman. So before we dive into this, I want you to know that there are no bad movements in general. There's no bad training. I would lean more towards movement is life. Let's embrace all types of movement and all planes of motion. Now, I generally think some movements are more beneficial than others. Like you get a better bang for your buck with movements like if you're thinking about the posterior chain, movements like step ups, the hip thrust, and deadlifts. Deadlifts are great. Loaded step ups, those are going to be more beneficial than some other movements. And I'm just blanking on, like let's say glute bridges without a load. I don't know. Or kettlebell swings. Kettlebell swings are more metabolic conditioning, more cardio-esque. But if you want to, you have to have an intention there. So, anyways, can you still do CrossFit pregnant? Yes, absolutely. And by the end of this podcast, you listening to this, what I want you to get is a kind of a framework in which to ask yourself or to share with clients or practice members, patients, and to put it back in your hands or your patients or your clients' hands because it's really good practice at owning these choices now and their possible outcomes, and to carry that over into the rest of pregnancy and labor and birth and postpartum and motherhood. So, can you still do CrossFit pregnant? Yes, absolutely. Most women do. Most women continue, like if they've already been doing CrossFit, for the most part, they continue CrossFit and they're absolutely fine. I do think in general, there needs to be some sort of conversation around the season that you're in and training for the season that you're in. especially in the CrossFit world and more globally, the fitness world in general. You know, I I view this like I used to work a ton in the sports rehab world and specifically on Olympic athletes and athletes in specific seasons. Um, CrossFit in general doesn't have a season, especially if you're not a games athlete or training for a games. CrossFit kind of is like year round. And what I'm getting at is you're in season training for birth. Like birth is your big event. Let's look at that. Just like an Olympian training for the Olympics, whether it be the 100 meters, the 400-meter hurdles, or a volleyball match, or whatever. They are in season training for their sport, and that's not going to look the same 2 years out as opposed to 6 months out. So when you're in season training for birth, that mindset shift right there is one of the biggest, most beneficial things you can do. Because when you walk into your CrossFit gym, you're not going to simply modify the WOD, the workout of the day. You're going to start shifting and thinking about training in season for birth. Okay? Okay. So there needs to be intentionality behind that. And that's exactly why I created the BirthFit prenatal training program, because we're in season training for birth. And every week, the body shifts and adapts and evolves and changes, and it's beautiful. There's innate wisdom in the body doing some big, big work. And if you're not honoring that or coming about this season with reverence, some things might show up. God might stop you in your tracks and say, "Hey, like pay attention, tune in, tune out the rest of the world." And I don't know how that God stopping in your tracks might look like. It looks different for every woman. But the mindset shift has to happen first. And then you can continue at your box. You can continue throughout um, pregnancy going to the CrossFit gym. Absolutely. When I was part owner of a CrossFit gym in Los Angeles, I would do consults with women and I would say, hey, you can train with me, prenatal training one-on-one, or you can continue in the gym. I can give you, general recommendations here. We can talk about this mindset shift right here. You can show up to class and you do you. You pick and choose and do all the things. You're responsible for you. And or you can lean on me. You know, I want that woman, I want this pregnant woman to know that she has the power. And these little choices right now involving fitness start to build trust in her body or not. So the real question isn't which movements are banned, which movements are safe. It's how do I, let's pretend like I'm pregnant right now, how do I, the pregnant woman, decide rep by rep or movement by movement or workout by workout whether this movement is going to be beneficial for me or appropriate for me in this season of life that I'm in, right? Like that's the question. And before I move on, I want to say there are no safe pregnancy exercises. There's no safe diagnostic test out there. Safety is an illusion. And with every choice throughout pregnancy, throughout labor and delivery, throughout birth, going into motherhood, in parenthood, on the other side, you are going to have to decide what is safe for you and your family. You're going to have to make your own risk and benefit analysis and then perhaps try on some choices, one choice at a time, and see how it feels in your body. See yourself a couple steps down the road on that particular choice and see how that feels. And then start to practice making choices that are in alignment with your values and your desires and your beliefs, and go from there. This is why we practice this in the gym with movements before even stepping out into the world. Before third trimester, before labor begins, we practice this with movement, because when we go into labor or when we show up in the third trimester and our waters start leaking, or we're 42 weeks, approaching 42 weeks, and an induction is looming, we've practiced trying on those choices and we know how they feel in our body, or at least we know kind of what they feel like in our body. So that it's not completely new or unknown or any of that. So here we go. All right. Inside, we're talking about movements now. We're talking about why we don't hand out a banned movement list in pregnancy. Your body is, for a number of reasons, but your body, your training history, and how your pregnancy is unfolding are all part of the equation. What we teach here at BirthFit is a mindset and a lens to focus on optimal core and pelvic floor function. We want a stable and dynamic core. And in order to have a stable and dynamic core, you need two things. You need all the muscles working in harmony together in that core cylinder, and you need to be able to create task-specific intra-abdominal pressure. And intra-abdominal pressure is a good thing. I don't know where it got a bad rap, but it's you have a cylinder that is a core, and that it's a pressure system. And it's designed to protect your spinal cord and your vital organs. This is beautiful. So you need whatever task you're performing, whether it's lifting a bag of dog food or a coffee cup or a 300-pound deadlift. You need all the muscles working together in harmony, because no muscle works in isolation in your body. The pelvic floor does not work in isolation. You cannot just contract your pelvic floor to walk across the room. There's so many muscles that are helping, that are engaging, that are working in harmony to make that happen. In fact, your diaphragm and pelvic floor are like buddies. They're like besties. They're always holding hands and they're always working together. So therefore, your breathing patterns are core work at the most foundational thing, at the most foundational level. Pregnancy increases the demand on every system, right? Like, it's also going to challenge your diaphragm's range of motion, whether you train or not, whether you like it or not. So training in addition to pregnancy, that's great, even beneficial, right? And let's pay attention to your internal pressure system. And let's honor it. Let's give it some grace. It's doing a lot of work. All right. BirthFit Basics. Your BirthFit Basics, which you can find free on YouTube. There's a playlist. I want these out there for free. That's why I put these out there for free, because we program these inside every training day in the prenatal training program. This is also why there's just a BirthFit Basics prenatal program. BirthFit Basics, I do a master class on these, a free master class. I have been at least once a month. Hopefully, maybe I'll continue. I don't know. But they are deep core prehab and rehab movements and poses. And these are, if not, they're the most useful tools inside of pregnancy. not just to warm up your body, but to use as a daily conversation with your body. And they also are foundational human movements. So you're practicing tabletop, you're practicing breathing sideline, you're you're practicing things that can actually carry over into labor. Tabletop was one of my most favorite positions in labor. If I did not have that arm strength or that core strength, that would have been a little challenging, don't you think? So, the BirthFit basics not only are used for deep core prehab and rehab, but they are used for a daily conversation with your body to check in and say, "Hey, body, how you doing today? I love you so much. Thank you for working so hard for me. How are you feeling?" And I go through the movements. I still do. Like the BirthFit basics are a part of my life. And what I find is maybe, oh, this feels good, or this was a little sticky. I wonder why. What did I do yesterday? Um, and it's literally you're engaging with your body, you're conversing, you're talking, and seeing what comes up. The goal isn't to train the body that you had last month or the one you're hoping to have postpartum. It's to work with the body you have today. And I think the BirthFit basics are a way to get present and tune in to how your body is doing today. And then inside of the prenatal training program, we have specific warm-ups for the strength or conditioning that is today. And then we have some down regulation. And the prenatal training days look like what we call a polyvagal theory sandwich. We want to remind our bodies that we're safe, and it's great and life is good before we exit the building and go out into the world. All right, so moving on. Now, if I had to put two movements on a banned list for this season, it would be toes to bar and sit-ups from like specifically in the CrossFit world. Not because these movements are bad, but if you think about it, like I want you to get your wheels turning, right? So why would I put these movements on the banned list? Well, deep spinal flexion under load is one of the more direct ways to aggravate the intra-abdominal pressure system. And these movements load a plane of motion where the range is already being challenged as pregnancy progresses, right? Like the belly's getting bigger, those sit-ups, they might just be like head flexion by the end of that. So you're putting a lot of, I think, unnecessary stress on the body, on the system, when there's a lot more beneficial movements out there. So beyond those, we don't really avoid movements outright in pregnancy or early postpartum, like that first 3 to 5 months. Instead, we regress to a previous progression of the movement. We alter the load, we alter the rep count, or we alter all three at the same time. So, how do we decide? Movement by movement, rep by rep, maybe. Before and during a movement set, think about this little checklist. Breath. All right. Can you exhale through the exertion part of the movement, right? Like the movement requires some effort, some exertion. Can you exhale through that without breath holding? And for sure, without bearing down. When we're 360-degree bracing, that's almost like a bracing out, not a down, like not a Valsalva. It's a bracing 360 degrees. It's an eccentric contraction of some of those big core players. If you're holding your breath to brace through the rep, the load has outpaced your capacity right now. Just, it's not good or bad. There's no morality to this. If you're used to lifting heavy with some breath holding, it will come back later. That season will come back. I promise you. Powerlifters, CrossFitters, I'm talking to you. Right now, The goal is to breathe, diaphragm breathe through training and lifting, even while stabilizing. So that would be the first bullet. Can you breathe? If you're doing a movement and some coning shows up, this is bullet point number 2. Maybe there's coning, doming, a bulge down the midline, whatever you want to call it. This is your system telling you the pressure is reaching its ceiling. Think of this as a yellow flag. Think of this as an opportunity for a choice. Hey, I do my best to put a positive lens on most things here. So when you see this, this is not a negative thing. This is not bad. This is an opportunity. So now you have a choice, right? Between a stimulus and a response, there is a choice. And when you start seeing these things, then the whole world slows down a little bit. So you have a choice. Do you want to keep going? And some women do. I mean, a lot of women do. Some regress to a progression that doesn't cause doming. So it's up to you. Some will stop and breathe and check the breathing pattern. And this is usually what I do when I'm working one-on-one with clients. For instance, if the dead bug is causing coning, then we stop, we slow it down, we check the breath, we check the bracing, the stability breath, and sometimes we go 1 breath per 1 rep, and that often solves the issue at hand for a few weeks at least until the belly grows. Um, or we do all 3, what I mentioned above. We check the breath, we regress, we decrease the load, we decrease the reps, that sort of deal. Think about a strict pull-up. That's a little more complex than a dead bug, but that may cause coning. In fact, it usually does on most women. Okay, can you reset? Maybe you're doing 5 reps. Can you reset and try 2 to 3 reps with your breathing? Maybe the coning's not there anymore. Okay, break your setup into reps of 2 or 3. That does not mean anything bad against you as a human being. Just know that. You're simply breaking up the rep count. All right, maybe that doesn't alleviate the coning and you want something more to alleviate the coning, then maybe a banded pull-up will alleviate the coning. Okay, maybe it doesn't. Then stand on a box and use your feet to take off some of the weight. Now you still have that vertical pull, right? Because we still want to go, like the intention of going through the full range of motion, keeping the intention of the movement. So it's a vertical pull. We want to go through the full range of motion as long as we can. Okay, now we have a box under us and that's taking off some load. Oftentimes that alleviates it. Maybe it doesn't. Then we sit on the ground and use a band for vertical pulling. See what's happening here? All right, so then that's bullet point number 2. Number 3, when I look at coning, the coning itself is not necessarily a bad thing, right? Like coning alone isn't bad. Like I said earlier, it's a yellow flag. You're approaching the ceiling. But when coning shows up with asymmetry, maybe it's wider or deeper on one side, especially postpartum, like if we're working on the foundation and rebuilding postpartum, this is like a global signal to me that compensation patterns and fascial slings are compromised. Or sorry, that compensation patterns are present and fascial slings are probably compromised. This is when I would absolutely stop and figure out what's going on. This is like the asymmetry is not super common, but I have seen it, especially in women that have had injuries from shoulder injuries, knee injuries, hip injuries in their past before even like especially before pregnancy. Um, when we're looking at DRA, and this is on previous podcasts, so I won't go down this too much, but when I'm looking at DRA, especially on the postpartum side, I want it to heal from the top down, bottom up. Around the umbilicus, especially if mama is breastfeeding, that's going to stay wider for longer. The approximation in the umbilicus region is going to be the last bit. So I'm not talking about that asymmetry as much as I'm thinking about, oh, the right side in the upper region is about 4 fingers compared to the rest of, the gap, the width of the coning or the abdominal separation. So that's what I'm talking about with asymmetry. Like you notice it and intuitively you feel like, oh, yeah, this is off. All right. Bullet point number 4. If there are symptoms that accompany this doming, coning, ab separation, such as pelvic heaviness, leaking, a falling out sensation, pain or discomfort, that's also when I would stop and adjust. Um, yes, I know mentally and physically you are strong to overcome this or to keep going, but is it appropriate in this season right now to push through? This is what I always like, especially when I was training women 101 in person a ton. This is the question that I would always have to go back to. Is it appropriate right now? Is it worth, you know, continuing like maybe pull-ups, okay, right? Maybe the doming comes with a little leakage on the pull-ups. Is it worth still doing? Because that's training your nervous system, your pelvic floor, your muscle, your core situation in a less than optimal manner. It's training it in a compensation pattern. So, belly tightness during exercise. Is this normal? Yeah, brief tightness or stretching sensations that settle quickly are commonly your belly and connective tissue adapting to the growing uterus. That's normal and different from coning with lingering pain or with pressure or heaviness. If it's ever accompanied by sharp or localized pain that doesn't ease with rest and shows up alongside any of the red flags, such as vaginal bleeding, dizziness, chest pain, sudden swelling, severe headache, visual changes, decreased fetal movement, or contractions, those would be red flags, and that's when I would say stop, reach out to your provider. Let's not continue just yet. Let's take it easy right now. And you want to work with that woman's provider, whether it be the midwife or the OB, and have her just check things out. But that is not a common situation. All right, so coming back to intensity, rebuilding intensity after the first trimester deload. You want to think about this as coming back from any deload week or any deload chapter. It's one variable at a time, observing your body, and then add load before any type of volume increase, speed, or impact. You have to have a base level of strength, especially in pregnancy. Impact. Things like box jumps, running, double unders, those tend to be the next thing to go or to watch as the belly grows and the pelvic floor is taking on more load. We're the only bipedal mammals, locomotive mammals, and our pelvic floor does a ton of work as pregnancy progresses and then in birth. It's wild. So let's just be nice to it, right? Do you really need to do double unders at 35 weeks pregnant? My thought is no, but that's my opinion. You do you. And it's these movements aren't bad. The impact of them is not bad, but just know it's the highest demand category for your pressure system. Many coaches, including the BIRTHFIT coaches inside of our ecosystem, shift to things like step ups with load early in the second trimester, simply because they deliver more bang for your buck for the posterior chain, for overall benefit without the risk of something like a failed box jump, right? Oh, failed box jumps are miserable. I've done that more than I've wanted to. And as I said earlier, there are no universally safe exercises. You will always be weighing benefit against risk for the season you're actually in. So you are responsible for you. And there's no better place to practice your choices and their outcomes than in the safe setting. I just said in the safe-ish setting of a gym. So a few FAQs here. I hit on this, right? Can I do CrossFit while pregnant? Absolutely. For most pregnant women, with a few modifications based on breath and the coning and doming as you progress, continue. You'll have a great pregnancy. You'll feel great in your body. And a lot of the times, women simply want to continue CrossFit because of that community, which is beautiful. I love gyms for this reason because there's a built-in community. So a lot of the times women will do the prenatal training program at their gym. They'll set up, in a little corner of their gym and be around their members so they can chit chat with their gym family and do the BIRTHFIT prenatal training program alongside that. So we hit on what movements should I avoid during pregnancy. I like, and I don't say this definitively because I've seen women continue toes to bar, but sit-ups and toes to bar would be on my banned list. They're at least on my early to cut list, and then followed by things like box jumps and double unders. Coning or doming during pregnancy, it's usually a yellow flag, not an automatic stop, just, hey, body, let's talk about it. And we just hit on stomach tightness. Usually this is a normal thing. It's common. And if it's accompanied by pain or sharp or localized discomfort, tightness paired with other red flags, that's when to stop and reach out to your provider. And that goes into my next FAQ. If there's any sort of vaginal bleeding, fluid leakage, dizziness, faintness, chest pain, unusual shortness of breath, sudden swelling, severe headache, or visual changes, decreased fetal movement, or persistent contractions with pain, let's stop exercising and connect with your provider. If you want more on this prenatal training, definitely get our ebook. It's called The Coach's Guide to Prenatal Training, and it's only 33 bucks. You would go to our website and you would go to resources, go to the digital shop, and you'd scroll down and you would see it. It's called The Coach's Guide to Prenatal Programming. And this is a practical framework. Let me see. It's a practical guide for coaches and practitioners who want to confidently program for their pregnant clients using our BIRTHFIT framework. So inside, you'll learn how to approach prenatal training through a nervous system focused lens with a clear guidance on core and pelvic floor basics, trimester specific programming, movement modification suggestions, and some sample training weeks. This is perfect for you if you're a coach, if you're a personal trainer, if you're a practitioner of any kind who really wants to stop guessing and start supporting clients with confidence, clarity, and appropriate challenge. Right? Like I hear that all the time. Like, I don't want my pregnancy training to be soft, because I'm used to strength and conditioning. Girl, we got you. So, I hope this episode was beneficial. If it was, it would be great if you could share it with somebody, share it with your girlfriends, share it with your mom friends, share it with your chiropractor or your coach or whoever is on your team. All right. Last thing I'll say, our BirthFit certification is open for fall cohort enrollment. We start the first week of September, and I would love to see you in there. This is for coaches and chiropractors. This is for personal trainers and practitioners. Get in there. All right, y'all. See you next time.